Okay, so I'm Bitsy, and this is my newborn assessment skills checkoff video. We are doing a lot of improvising. This is our bat baby right here. Um, in the assessment video, we're going to start out with co-wipe. So I'm going to check for the orders. I'm going to check allergies. I'm going to check the identification on my patient, wash my hands, provide privacy, and educate and explain what I'm doing. So first things first, wash my hands, close the door, provide privacy. I'm going to explain to mom or dad what it is that I'm about to do. Basically tell them I'm going to do a head to toe assessment of the child, make sure that everything is the way that it should be. At this time, we don't know of any allergies, and I've already checked my order. Basically, my order is this is a newborn child that I am just going to perform a quick head to toe full assessment on. So first thing that I would do, I've washed my hands. I'm going to come over, I'm going to start laying my hands on the child. I'm going to assess the epical pulse, respirations, and an axillary temp. For the epical pulse, it should be between 110 160. I'm going to take it for a full minute. My respirations should be between 30 and 40. I would take those for a full minute. And my axillary temp would be between 97.6 to 98.6 or 33 to 35 Celsius of the child. So first thing, I would listen for the epical pulse, counting it for 1 minute, watching the rise and fall of the chest for 1 minute, record both of those for later purposes of documentation. I would take the axillary temp. Once I've gotten those measurements, my next step is going to be taking measurements of the child. First measurement would be around the newborn's head, going right above the eyebrow line. And the normal measurement for that is between 13 to 14 inches or the 33 to 35 centimeters. So that's the measurement here. Then I would also measure right at the nipple line at the lower part of the scapulas of the back, and the measurement for that should be 13 to 14 inches or 30 to 33 centimeters around the chest. Then I would measure right above the umbilical line just to get a baseline measurement of what the circumference is of the abdomen. Once I have accomplished that, the next thing I'm going to do is start checking for the patient's reflexes. So the first one is the Marco reflex or Maro reflex. It's basically making a loud, high-pitched noise or a sudden lowering of the infant or the newborn. So I would do this or say something loud, and I'm watching for the baby to straighten out the arms or the hands, and I'm kind of watching to see if they flex up their knees. Second reflex, that one was the startle reflex. The second reflex is the rooting. I believe it's called rooting reflex, and it's where you rub the cheek line of the infant and you're watching to see if the infant turns their head towards you and opens their mouth. That usually stops around 3 to 4 months. And the other reflex, the one that we did, the startle reflex, sometimes they cry. That reflex typically stops between 3 to 4 months also. The third one is the grasp reflex. I'm going to touch the inside of the palm, and the newborn infant will actually grab or grasp at my hand. So those are the three reflexes that we check. The next thing that I'm going to do is I'm going to assess the skin color of the baby. It is typical for them to have some cyanosis in their fingers and in their toes. I did forget the name of that, but it's basically a slight bluish color, and it is normal. It is not normal, however, to have bluing of the trunk or the abdomen area. If I see that, I would definitely notify the physician immediately of those findings. You can also see sometimes like a molting of the skin. That also is not normal, so I would alert my physician for that. After those are done, I'm going to check the fontanelle. So this is the anterior fontanelle, also known as the soft spot. It's usually a diamond shape, in nature, and it does usually close up about 18 months, usually somewhere between 3 to 4 centimeters, I believe, up here. And the posterior fontanelle is a triangle shape and usually closes around 2 months of age. And it's usually about 1 to 2 centimeters. So if I noticed that there was any bulging of the fontanelles, then that would indicate to me that there is some kind of intracranial pressure in there. If I noticed a sunken fontanelle, then that lets me know that there's some dehydration going on. I'm also going to be looking for suture lines around the newborn's head. They should be normal and transient in nature. Once I've assessed that, there also should be some modeling. So basically, I can feel the bone overlaying of the suture lines of the skull. They will typically disappear within a couple of days of the baby. It's also just from like misshapen or misformation of the head from the labor process. Once I have assessed the head, I am also looking for any kind of edema around the soft tissue of the scalp, and I would notify my physician of those findings also. So I am going to then start looking at the pupils. I want to make sure that they are perla. So I'm checking to make sure that whether or not they're dilated, that they are symmetric, that the baby follows the light, that they dilate or constrict with light. I'm looking to see if there's any kind of swelling of the eyelids. Sometimes babies will get that, and it can be treated prophylactically with antibiotic ointment. I'm also checking to see if the baby is cross-eyed in nature. Some infants do have that, or newborns do have that. Is due to the immature nervous system or central nervous system. So I would make any kind of documentation about that. I'm also looking to see if there is any congenital or conjunctive issues going on with the eyes and if that needs to be treated. So then I'm also going to make sure that the lining of the eye and the ear are equal. I believe basically you're checking for the area of the insertion of the pinna of the ear, making sure that it is corner with the center of the eye lid right in here. So once I have assessed that, then I am going to go ahead and make note that infants will typically always recognize their mother's voice or high-pitched noises. And I am going to start to work my way down. I've assessed the head of the baby. So now I'm going to be checking the chest. I'm looking for symmetry. I'm looking for even rise and fall of the chest during breathing. I'm going to lower down into the abdomen area of the baby, making sure to auscultate for bowel sounds of the newborn. So I would once again use my stethoscope. I'm listening for the bowel sounds of the baby. And while I'm listening for the bowel sounds, I am also going to start to inspect the umbilical area. The umbilical cord should still be intact. I would clean around it, warm water, and educate the mom that this will start to fall off anytime between now to 2 to 3 weeks after the baby has been born. I would educate her that she can clean it with a Q-tip and alcohol just around the base of the umbilical cord. I'm noting whether or not there's any reddening or signs of infection around the umbilical cord. If this was a male, I would then go ahead and start listening or looking for the circumcision of the child. Once I've done the auscultation of the breath sounds, I've now checked my umbilical cord. Now I've moved down into the groin of the baby and I'm checking that circumcision. If it was a female, I would make sure to do pericare, cleaning it, keeping it warm and dry down there. On the male, I'm checking to make sure that there is no signs of infection around the circumcision. I would clean it with a warm rag. I'm checking for any kind of odor and drainage or discharge from there or the umbilical cord. Once I've made any documentation needed for those areas, I could clean off the circumcision with warm rag also, and I could replace the petroleum jelly pad that is usually placed on right after circumcision. So once I have checked the circumcision, then I would also go ahead and check the bottom of the newborn, making sure that that is clean and dry, making sure that there is no redness or anything around the anus of the baby. And I'm going to check the newborn's extremities now. So I'm looking on the arms and the legs, making sure that they are equal, making sure that the baby is able to move them, that there was no trauma during the labor causing a fracture of the scapula or any kind of dislocation. I am going to check the baby's legs, making sure that they can move and they are equal in nature and that there is no hip dysplasia causing one leg to be shorter than the other. I would then go ahead and turn my newborn over, and I'm going to look at the back of the baby. With the back of the baby, I'm looking to make sure that the spine is straight, that there is no abnormal curvatures. I'm checking for any dimpling or wrinkling on the baby's back, and I would make documentation of such. If I noticed any kind of mass or area of trauma, I would of course alert my physician and let them know of any of that stuff, because it can indicate something a lot more serious. When I'm checking again the hands and feet of the newborn, I'm checking to make sure that there are 5 fingers on each hand, 5 toes on each foot, and that there is no webbing in between them. Once I have done this, I'm once again going to check to make sure that the identification band that I can stick 2 fingers underneath so it's not too tight. I am checking to make sure that it is the correct baby, correct parents, and after that, I would just go ahead and document all of my findings. And that completes my newborn assessment.